Hi, and welcome back to the Hippie Martha Hormone Hour, where we dive into all things hormones, healing, nourishment, and getting to the root cause instead of just chasing symptoms. Today's episode is especially meaningful to me because I'm sitting down with someone who has personally been a huge part of my own healing journey. Like many women, I originally sought help for hormone concerns, but what I quickly realized is that true healing rarely happens in isolation. Working with today's guests meant peeling back layers: stress, metabolism, inflammation, gut health, nutrient deficiencies, and lifestyle factors. All things that actually contribute to how we feel day to day. What stood out to me most was finally feeling listened to, not rushed, not dismissed, but genuinely heard. So today, I'm welcoming Dr. Theresa Osmer with Flow Chiropractic to talk about functional medicine, root cause healing, fertility, supplementation, metabolic health, and what optimal health really looks like for both men and women. With over 14 years in practice, she brings both professional knowledge and personal wisdom from working with countless patients navigating complex health concerns and healing journeys of their own. Whether you're trying to conceive, struggling with symptoms no one seems to have answers for, or you're simply curious about more holistic approach to health, this episode is going to be packed with insight. So let's get into it. Welcome, Dr. Osmer. Thank you so much for being on the show. I'm so glad that you were able to join us.
Thank you for having me. As soon as you asked me, did you notice I jumped right on your schedule and I
Yes,
booked it? Like that is my almost toxic type A personality. I was so excited I had to jump on it.
I love it. I think you were in Florida too, weren't you? Like you were
I
enjoying
I
or
I
doing
think I was
something.
somewhere. Yeah, I was somewhere.
That's amazing. Hey, as I said earlier, I met you around, I think it was like 6 years ago. I'd have to like look back on the timeline, but it was during one
Mhm.
of probably the most difficult times of my life. And you were just the first person who listened to me, who offered testing to get more answers. And I was just so, so grateful. And I'm still grateful. I mean, we work together. Now we're on a yearly basis, I think, right now. But I'm just really excited to have you be here and share with the listeners just your knowledge and kind of some of the things that you deal with clients and how you help them like you've helped me. I typically start with a cycle check-in. So if you would like to check in today, that would be great.
Absolutely. And I saw that on the list and I was like, okay, I have to check my app to see where I'm at. I typically have a good idea, but I knew I was gearing up for ovulation, like I'm in that kind of mid to late part of my follicular phase. So I'm cycle day 11, and we're going to be seeing probably some cervical mucus soon and, all that good stuff.
Yeah.
Yeah.
Yes, I love it. I know. I
Which is
am
also a great day to have this interview
it is. And this is
for
what's
me.
so funny is every time I interview someone, typically like they're right during that follicular phase, and I am either cycle day one or like late luteal. So, it's just the way it works.
Yep, totally.
So,
You're living on our schedule, not
yes.
the opposite,
You
probably.
got it. You got it. And that's okay because I'm not doing all the talking. So it's
It's
totally
true.
fine.
Fabulous.
Well, let's start and begin by I always start with your story. So I kind of want to hear how you became a functional medicine doctor because that was not your initial route of training, correct?
You know, I have always been fascinated by health, and I would say my fascination probably started when I was like tabloid height and I was reading all of the lose 25 pounds in 3 weeks, like all those, things and teen magazines and all of the whatever. Like that really always caught my interest. I was always fascinated to learn how the body worked. My dad is a medical doctor, so I grew up in the hospital, rounding on patients with him. After church on Sundays, we'd head over there so he could see patients in our small town hospital. And so I've always been fascinated by health, and that's what led me to chiropractic. But it was the classes that were more about physiology, specifically when it came to hormones, that I was so fascinated by. So I've always directed my education, especially things outside my curriculum, towards this route.
Yeah, I love that. Since you grew up in that space too, can you tell us the difference between conventional medicine, functional medicine, and naturopathic medicine? Like what is the difference if someone wanted to explore that?
Yes. So I tapped my friend Kelly, who is a naturopathic doctor here in Grand Rapids, Dr. Kelly Peterson. I was like, how would you describe the difference between functional medicine and naturopathic medicine? And I really think it comes down to we all get our degree in something, whether you're a medical doctor, a DO, a naturopathic doctor, or a chiropractor, you get your doctorate, you have your base of training, this curriculum training, and then everybody can kind of do with that what they will. And I do think naturopathic doctors, their training is in that functional medicine mindset. And she said there are some tenets within naturopathy that they learn as well, but a lot of them end up practicing like functional medicine. And then us chiros or medical doctors or osteopathic doctors or nurse practitioners or whoever can then learn more about that thing that maybe the naturopaths had all along.
Yeah.
So that's how I describe that training. Conventional medicine, I've met DOs and MDs, medical professionals who have geared more towards functional medicine. You can certainly do that. But when I think of conventional medicine, I think of it as, you need life-saving medication, surgery, care, intervention. Like that's what that system is so good at, and where I think a lot of people end up in my office because they don't fit into that and they need a different approach.
I think that's a beautiful way to describe that. Do you see yourself as, I guess, what do you prefer? Do you prefer the chiropractic side or do you prefer the naturopathic side?
Oh man, I'm a Gemini. I don't know if you know anything about Geminis,
Yes.
and I don't really know a whole lot about astrology other than my best friend from chiropractic school is very into it. And she has explained to me that this is very common for Geminis where you have a lot of interest and you got to keep things fresh. So I actually love that in my day, like today, seeing patients, I had a little bit of everything. I had chiro, my prenatal patients, pediatric patients, athletes, like so many different chiro. I had some Mercier clients, and actually one of my patients that came in was like, we couldn't do treatment today because she didn't need me anymore, which was
Yay!
like that's
That's
good
exciting.
just for that, which was so exciting. And then I have my functional medicine. I had all of that today, and I love that. But where I think for me, some days I'll be like, oh, I just want to do functional medicine. I don't want to do any of the other stuff. But I love the variety, and I love with chiropractic, it is a really great entrance point for patients. They come to me because they understand chiropractic to a certain extent, and then they learn about all the other things I do. So I love that I can capture this subset of people that maybe I wouldn't otherwise meet.
Yeah. What are some of the biggest misconceptions you feel people have about functional medicine?
That it is a quick fix. This is not a quick fix. I like to tell people I don't have a magic wand. I can't make your symptoms disappear with this one product. And that one product that you're sending me is probably not going to be the magic wand either. And I know as humans, it's such a human thing to want that, especially in this day and age of immediate gratification. But I think that's the biggest thing. And that I am also not emergency medicine. Like
Yes.
if something is bad enough that you need to talk to me at midnight on a Saturday, I'm probably not the right person for you. Or,
Right.
like the right
Yeah.
practitioner, like maybe that's a trip to the ER or whatever.
Absolutely.
So
I also feel like functional medicine is really helpful in just understanding things that maybe haven't been explained to you in regular
mhm.
medicine too. Like I feel like you're a really good educator. I know when I came in, like we sat down and it was like an hour and a half long, just, okay, this is what this means and this is what this means. And that is
Yeah.
so valuable to have because in the regular medical system, they don't take the time to do that. So I think from a functional practice, that is super helpful.
Oh my gosh. I love that you said that because the first thing I ever wanted to be in life was a teacher. And being the oldest of my siblings and my dad as a medical doctor, he's like, no, you're going to be a doctor. So, and I was like, how about a veterinarian? Because I love animals. He's like, no, like you will. And now I know I'm like, I would have crumbled as a veterinarian because I love animals way too much.
Same.
My soul just would not be able
I
to
know.
handle it.
I feel you. It's my daughter wants to be a vet, and my husband's like, there's no way you could be a vet. You are more sensitive with animals than you are
Oh, so
humans. And I'm like, I totally am. just,
Oh my
it's just the
gosh,
way it
yes.
is.
No, anything animal related on TV, I'm like, no, that dog, nothing better happened to that dog in this
Yes,
show.
I feel you.
Totally.
That's funny. When I was working with you, and I still work with you, I'll just say that we definitely have a connection. One thing that stood out to me is how thorough you were with my health history. I had never answered so many questions. It was like page after page after page. And
Mhm.
I remember sitting with you the first time, and you were like, okay, let's go back to when you were born. Like, were you breastfed? All of these things. Why is a full timeline so important when you're trying to get to the root cause?
Mhm. I think a timeline just really tells a story for a patient, and we like to identify something called a hasn't been well since date. Like, when do you remember things really shifting in your health? Okay, so maybe it was freshman year of college. I feel like college a lot of times, well, that's when people's things start because their nutrition is different, they have a lot of stress, whatever. And so it's like, okay, that's when you first remembered not feeling well. So, what are the factors leading up to that that maybe impacted your resiliency? Because it's never one thing. And I think in our minds, we have this. I just read this thing about creating too much fragility. It's like, oh, I got a bad day of sleep, so I'm going to have a terrible day today. And it's never that one thing. Your body can be so resilient. So we want to understand what are those factors leading up to that hasn't been well based on your nutritional history from very young, your medication history, surgery stressors. And this is actually where my chiropractic can really come into play. We have something called the 3 T's of basically it's the 3 T's of subluxation, but I think of it as the 3 T's of disease, which is traumas. So what type of physical stressors have you had? Traumas, toxins, which can be, nutrition, medications, environmental, but even too many supplements too. I see that all the
Oh
time.
my
People
gosh.
taking way too many supplements.
Yes.
And then thoughts. So traumas, toxins, thoughts. And like, what has that journey been for you so that I can understand what things do I want to investigate? What things could be a meaningful part of your health history that we want to peel back, like the onion, peel back and be able to predict a timeline moving forward too. How long do I think it will take you to see some meaningful change and improvement so that you can set that expectation right away for people?
Yeah. I loved that when I first worked with you. You were like, all right, there's a lot going on here, but here's what I think would help the most. And I think that was just really nice to know that straightforward. And from someone who was just so miserable and just was searching help, right? Like it's
Hmm.
good to just to get those little gratifications just a little bit and see
Yes,
that progress. And then be like,
absolutely.
okay, well, we worked on this. It's getting better. Let's add this in. And like, you weren't just like okay, let's do this, this, and this. Like, it was literally like little things that kind of moved the needle, which was super helpful.
Yep,
Yeah.
absolutely.
Can you talk about why healing isn't usually a quick fix and why it takes the peeling back of those layers?
I think the biggest thing is that consistency is boring. And sometimes, a lot of times, people just don't stick with something long enough to really see the benefits. I think probiotics are a great example of this. The research says you need at least 12 weeks to see improvement on a probiotic. And most people will use like a bottle. So maybe it's like a month of probiotics and be like, oh, well, that didn't do anything for me. So I think a big thing standing in our way to like reaching maybe our goals, but really like when you reach the goal, that's such a small part of the journey. And like, what does that even mean? Because we're constantly changing. But I think it's the not doing the boring, consistent things, which would be getting enough sleep. That is probably the biggest thing I see. Not enough sleep, too much screen time, and like information overload that creates this confusion and like, oh, maybe I'll jump to this next thing. So that's definitely a big piece of it. But a lot of times when somebody's coming in to see me, more often than not, they've had years of things happening that we're trying to also unravel and figure out what is the first thing that we can work on that's going to be that easy win for you, that thing that you
Yeah.
can get consistent with the fastest. And it's just going to take time so that you don't feel overwhelmed.
Do you have any tips for consistency? I know I just posted about consistency, but what do you recommend? Or how do you help people stay motivated even during those boring times of just the daily grind?
Absolutely. I think it's finding that one thing that you could do consistently for a month, right? They say it takes 30 days to create
Mhm.
a habit. What is that one thing that you can do that is an easy win? And it might just be eating breakfast. Like so often people are skipping breakfast. Like I'll even start, like, I don't even care what you eat. I just want it to be something so that you're getting back in the rhythm of that one thing. So choose one thing that you can feel good about being able to implement for 30 days. That is like you said, an easy win because we all like to win.
Yes.
And if having perfect health was easy, everybody would do it and be able to obtain it. It's not easy, especially in today's day and age. So it's like increasing that resiliency one habit at a time. And that's what I like to think about. We are increasing resiliency even if you don't notice a change a weekend.
Absolutely. Yeah, I agree. I know you had said phones and lighting. Do you want to talk a little bit about circadian rhythm and how that can have effect on our body? I know this
Absolutely.
wasn't this wasn't on our list, but it kind
No,
of triggered
no,
something.
it's
So,
great. Yes, totally. Something I like to find a win with because pursuing functional medicine for people will cost you money. And it's going to cost you, like, it's not covered by insurance. The testing's not covered. The visits aren't covered. The supplements aren't covered. The food's not covered. Like, it will cost you money. So, what is something free that literally everybody has access to? And it's being outside and trying to be in a rhythm with nature because nature can teach us so much. And it's just such an amazing thing that the light that we get exposed to in the morning with the sunrise helps to bring up our cortisol. It stimulates the photoreceptors in our retina to like help our cortisol so that we feel energetic and can reach that peak. And then we will taper down so that we're tired before bed. And those sun rays at dusk do the opposite, where it's helping us feel sleepy and get rid of some of that cortisol. So it is something free and good for everybody, especially if you can be out there without sunglasses on, maybe like not even listening to anything, just listening to the sound of nature, going for a walk with a friend or your dog, because we all know we love dogs here.
yeah.
So that's what I love about that, but it's so good for your like day in, day out hormone cascade. Women are on a month-long hormone fluctuation, but all of us, men or women, are on a every single day hormone fluctuation between our cortisol and melatonin.
Yeah, and I know I see a lot of people with dysregulated cortisol. And everyone's like, "Well, what can I do? What can I do?" You know, we see all these drinks and adrenal cocktails and all that stuff,
Mhm.
which can be helpful, but if you want just something free, just go outside.
Absolutely. Oh my gosh, there was this study that I was reading about exercise, and it had people literally exercising in a closet, like no windows, and then people exercising outside. And they both had health benefits in terms of cardiovascular health and muscle and endurance and all of that. But their mental health, they felt so much more positive and probably looked forward to continuing to exercise if you could do it outside in a better environment. But just being outside, how much that lowered stress, which we all know exercise does that anyways, but being outside. And that's why I think one of the most underrated health things is going for a walk.
Yeah,
Like,
absolutely.
if you can
Yeah.
be outside going for a walk, that's
Even
like,
just like 5 minutes. Like I tell a lot of my people who are like, I don't have time. I'm like, do you have 5 minutes? Like, do you have 5 minutes just to step outside and embrace the
mhm.
daylight? It could be cloudy. I know in Michigan we get kind of random days, right?
Yeah.
But even just getting the outdoor light versus what we have indoor can really make a
Uh-huh.
big difference. Like you said, it lowers our stress, it supports our nervous system. It plays a huge role in our metabolic health. So,
Mhm.
um, kind of
Yep.
leaning more towards hormone and metabolic health. When you see clients, how important is it to support metabolic health? And I guess what does metabolic health mean to you?
Metabolic health to me is that your cells can bring in fuel. So your cell will bring in glucose in response to insulin, unless the muscle's actively working, then we don't need insulin for that, which is such a great hack. But we bring that glucose into the mitochondria and exchange that glucose or transform it into ATP. Everybody remembers ATP. It's so funny with my patients. I'm like, do you know ATP? They're like, I remember it's the powerhouse of the cell. from like, high school
Oh
biology,
yeah,
but
we're
they
I'm
don't
in it
really
with
know
my
what that is.
daughter. We're
Yes.
freshman year biology this year. It's been
Yes,
fun.
absolutely. Absolutely. So that to me is metabolic health. Can you do that? And I think for the most part, a lot of people I see their mitochondria is so dysfunctional. Either we're dealing with insulin resistance and the glucose can't get in there, or we don't have the cofactors. I mean, I taught, again, going back to my teacher roots, I taught college. I love this. This is what I'll do in retirement, college biology, physiology, anatomy classes, and going through that Krebs cycle and all the little products and cofactors and then the electron transport chain and all of that. Like, it's amazing that even happens in our bodies without us actively thinking about it, but it requires magnesium and B vitamins, and it really does not like it when we have heavy metals or mold or yeast or some pathogen that's standing in the way of being able to
Yeah.
do that, so we get buildup. So that's metabolic health to me, is that we have robust mitochondria. So of course, I think that as a medical professional, my patients are thinking of their body composition and that they're having trouble losing weight, so they have a sluggish, slow metabolism.
Mhm.
And I would say the majority of people I see, it's not they think it's their thyroid. A lot of times it's not their thyroid, it's that there is insulin resistance. And when you calculate, I think this is the most underrated test that everyone should have done, is not only with most people will have a CMP that has their glucose, most people will have a hemoglobin A1C that's showing your 3 months of blood sugar balance, but not a fasting insulin. And you can calculate, do you know what the insulin resistance score is?
I don't.
This is gold. This
Explain
is
it.
gold to
Yes, explain it.
calculate your level of insulin resistance. So you multiply your fasting glucose times your insulin level, and then you divide it by 405. And I think of this as a ratio of like, how much insulin do you need to have your glucose at that fasting level? Because otherwise, that fasting glucose doesn't really mean very much, because it can
Hmm.
fluctuate moment to moment. But if that number is under a 2, you're doing well. If it's under a 1, you're doing really well in terms of your insulin sensitivity. And that's that first step. We got to get glucose into the cell for our metabolism.
Yeah, I love that. And I also, for my midlife people out there, you need good metabolic health in order to go through perimenopause and menopause. And you need, like, prior to menopause, you want healthy, strong cells. You want to still be ovulating. You want to, things might fluctuate and shift, but our egg cell is one of the largest cells in our body and it holds the most DNA. And so if we
Thing.
don't have enough of that mitochondrial power, we aren't going to ovulate. We aren't going to get the hormones our body needs. And so it's so
Mhm.
important to really, focus on that metabolic health, which is, I talk about this over and over. If you've listened before,
Yes.
I'm sure you've heard it. Like, this is something that is just so, so important to really understand. So thank you for sharing
Mhm.
that. I appreciate that.
Yes. Yes.
Going off of that metabolic, do you feel that there's one specific system in the body, such as gut health? You've already mentioned thyroid, the nervous system. What one do most people struggle with the most?
I'd like to say that's really challenging, because I think it would be a tie between gut health and our nervous system. I do think the nervous system is the primary one. And it's that classic, somebody comes in and they're like, I quit my job and my gut feels so much better. Like, this gut thing we've been working on for the last year, gone. And I quit my job and my stress is so much less. And so I want to say nervous system, because most of us are just totally inundated with too, like, information overload, too many responsibilities, too many commitments. We're so connected to a fault that our nervous systems are having a really hard time pulling back from that, so that we can be in more of a rest and digest system. So I think that then throws off the gut, and then our upper digestion slows down. And most people want to go right to the probiotics that I mentioned earlier, but we're not chewing food. We're like overhydrating at meals. Our stomach acid is gone. And,
Yes.
and then that like throws all of that off. So
Yeah.
I would say the nervous system. And as a chiropractor, maybe I'm biased, probably, but there is amazing research coming out of New Zealand. Dr. Heidi Havoc, her work on what chiropractic really does, what those adjustments really do, and how it helps to remap the brain. And like they'll put like electrodes on both the doctor, the chiro adjusting, and the patient, and see that how their brain waves relax, like go into this more calming brain wave, even during the assessment, not even the adjustment, like the
Oh,
assessment
wow.
hands on a person. It is like so cool. So I think chiropractic is such a great tool, but then, we can be told to lower our stress all day, every day, but it's digging in and doing it that part.
Exactly. Yeah. Do you have any, other than like getting outside and things like that, do you recommend any ways to lower stress and to kind of help the gut? Like any little fine-tuned tips?
That I do think, like, I take this from an instructor I had who is from Europe, and they were like, the weirdest thing when I moved to America is that you guys eat while you're doing a million different things. So I think that's my first thing, is trying to actually just eat while you're not in the car on your way to
Hmm.
work. Like, eat before. Hopefully you can have a bowel movement before you leave, because you got to eat to have that happen. There's a reflex.
Yeah.
And so, if you can help both your nervous system and your gut, I think it's that you have meal times that are just meal times, and you're not trying to. And I do this too. I'm working through lunch all the time. I'm prone to it as well, but I grew up where we all had dinner together as a family, like every night. And my husband and I still do that. And I think most of my sisters do that as well. Like, that is such a grounding thing, that you come together and can flex that. You know what your social Vegas is?
Yeah. Yeah.
Like, get that vagus nerve, that social outlet. So,
Absolutely. I think that was one of the main, that and not having water like a half hour before eating was one of the main things that helped my SIBO. Like it really just helped diminish it. And then adding that nervous system health on top of it, just not going all the time, sitting your butt down to eat. We have a
mhm.
counter. And I would always stand on the opposite side of the counter and I would stand there and eat while I was like getting stuff for my kids. And finally I was like, no, this is dumb. Like they get to sit down. I should get to sit down too. So, I mean, we were all together, but just those little tiny habits can really help things.
Yes,
Awesome.
absolutely.
Let's switch gears just a little bit because I think a lot of listeners, and I'm assuming a lot of people come to you who are trying to conceive, they're having troubles. What does optimal health look like before trying to conceive? And I know there's a lot of talk right now about this, so I think it is kind of good to address from a functional health perspective and from those who are trying to get pregnant.
That this is like such a common thing that'll come up with my patients who are dealing with fertility struggles, that they get so frustrated because they have so and so who is like eating Doritos and drinking soda and smoking cigarettes and all that, and
Mm-hmm.
like just having babies left and right.
Yeah.
And I think it's that mindset of like, yeah, like, yes, sometimes that, a lot of times probably pregnancy is not super difficult for people to achieve. I do think there's a lot of unknowns there, like how healthy is that child? Like how, like
Mm-hmm.
mentally, emotionally, physically, like there's so many things that go into that. So I do think optimal, like being optimally healthy going into conception is doing, like, approaching that from the standpoint that you are doing this for yourself, for your long-term health, knowing that pregnancy is a side effect of optimal health. And when I put some numbers or objective information into there, things I'm looking for on blood work are having a well functioning thyroid, where you have enough free T3, that's the hormone that runs your metabolism, and baby relies on that free T3. They can't make their own free T3. So this is for my people, especially with recurrent miscarriages, can be a struggle.
Yep.
So we want to have that good functioning thyroid going into pregnancy. Again, that insulin resistance number I look at, inflammatory markers I look at, nutrient status. So I see a lot of babies with tongue, lip tie, feeding issues. And so a hot topic, especially when I started in practice 15 years ago, was all the MTHFR gene mutation and having too much homocysteine and not enough folate and B12. And choline is another important aspect of that. But trying to lower those risk factors that could impact the health of your baby or even your long-term health, pregnancy aside. So I think that's huge. And then being in a good place, like emotionally, there's a book called Spirit Babies. Have you ever
Yeah,
heard of
that's a
that? And whenever I have a patient read that, and I'm always like, I don't want people to think I'm like woo woo, or, I'm like, careful who I even talk to about that book, but whenever I have somebody read it, the most interesting things happen to them after when they have that little switch in their consciousness around conception. And children seem to come to them in very unexpected ways. Maybe it's not directly through pregnancy, but it's through adoption or fostering or, whatever. So,
I feel very similar in the way that, people usually come to me, they want to start charting their cycles, they want to learn more about their hormones and cycles and, timing for conception by looking at their charts. And
mm,
sometimes it can almost be very frustrating for them. It's just this like, what am I not doing right? Whereas we need to really look at the bigger picture is, what is going on? And I that's when I typically am like, okay, we need some outside support because either I notice something on a chart and I'm like, okay, this is what I'm
yeah.
seeing. Like you said, the thyroid issues, a lot of that comes up when someone starts charting their cycles. And so I think it's that. And I also ask them, and I know we've talked about this a lot too, is what does their spouse look like? What does the sperm look like? And so, can you just
Yes.
touch a little bit on supporting fertility for both men and women? I know we've already talked about women, but for just supporting fertility for
Yes,
men.
absolutely. And this, I do believe there is more information coming out about this to motivate men to like take their health more seriously and know that that does play a role, even if you have a great count,
Mhm.
a great sperm count. Like it's so much more than that. It's how healthy is the DNA in that sperm and how mobile or what's the motility of that sperm. There's so many other things. And even when it comes to connecting morning sickness severity and placental health, that is really heavily connected to the health of that sperm. So I do like in a perfect world, I love when couples come to me together, like the Mercier therapy that I do, that's the abdominal therapy, that is for women. Like our reproductive organs are on the inside, and I work on those from the external abdomen. And that is something that I really treasure with my female patients. But I love when their husbands are wanting to maybe do some chiropractic to help support their nervous system, or they want to do a blood panel and just see where they're at, maybe a more detailed semen analysis to understand those other factors of fertility because it's more than just do you make sperm, do you ovulate an egg? I think there are a lot of things we don't truly understand about how is it that that egg chooses that sperm for conception to even happen? What goes into that? I think it's so interesting, and if we can have both people on the same page in our, like life we can see, what are the things that happen with the things we can't see when you're on the same page with your health?
Yeah, absolutely. And I mean, it takes two. So like, they
Definitely
should be
takes.
responsible too, right?
Absolute. I mean, I see this all the time. Women have just an immense load. The women's load is something we all talk about. We have such a big load, and then you pile this responsibility, this primary responsibility on us as well. And I'm seeing women doing all the things, and then especially in my Mercier sessions where it's an hour-long session for 6 weeks. So I get to know these women really well, which
Mhm.
is another thing I love. And you start to see like wow, like you're doing all of this and you have very little support with your partner. And it seems like there is a disconnect happening in your life that is maybe affecting that
Mhm.
conception.
Do you want to share a little bit more about the Mercier therapy and what that is?
Yes. Oh my goodness. I can't even remember how I initially heard about. I honestly, it was probably a podcast I heard about Mercier therapy, and I loved that it is this like hands-on physical component because I do think physical touch is such an important thing that we can do as chiropractors, and we're so good at doing as chiropractors. So Dr. Jennifer Mercier is based out of St. Charles, Illinois, and she was a midwife. Massage therapist, I think, was her initial thing. So she had that tactile PhD. I believe she has a naturopathic degree. Like she is just in it. She worked in reproductive medicine, like she had worked in
Okay.
a clinic. So she understood that. And she dealt with her own fertility issues and kind of blended all of her gifts and abilities and came up with this Mercier therapy technique, which is a deep pelvic organ myofascial release. And it's similar, if anybody's ever heard of mind abdominal massage, it's similar, but the differences I've heard is that Mercier therapy is much more focused on those reproductive organs and working on that anterior abdomen or the front of your belly. So the goal with that is to improve blood flow, to improve mobility of the organs. And then a lot of my patients have had C-sections or laparoscopy procedures or appendectomies or some type of surgery that maybe there are some adhesions that we're just working on the pliability and health of that scar tissue. So I love I
Yeah,
love that
that's awesome.
technique.
Do you also get a lot of those who have struggle with endometriosis?
Yes. Yep. A ton of that, especially like post-surgery after they've
Mhm.
had their laparoscopy procedure. Yes,
Cool.
for sure.
Yeah, it's such a great practice. It brings not only that touch component, but blood flow and putting a lot into specific positioning of where the massage is going and just intention. I am
Yeah.
sure you put lots of intention and love into
Tension.
it too. So,
That is, I think that's the biggest thing. Like, even though we're focused, and I say it's a 360-degree view because we're working the anterior abdomen mostly, but then I still like I'm mobilizing the sacrum. I'm seeing if there's tension being held through the low back or the hips. So we're also looking at that component to affect the backside of those organs. But after women have experienced this technique, they get off the table like, whoa, I am in like such a zen place right now. And I think we hold a lot of
mhm.
emotion in that. It's like your pelvic chakra, right? Like
Yeah,
in energy
absolutely.
work, like we hold a lot of emotion there. And by having that physical technique, a release can happen. And just the increase in cervical mucus that women notice, the things that when they're menstruating that end up coming out, it's
Yeah.
really, I've gotten some pictures.
Yeah.
Gotten some pictures.
Well, and I think also note that for optimal fertility and trying to conceive, you want the uterus and womb to be in a specific part. And so, like, if you've had, like, for instance, if you've rode horses and had lots of falls, or you've had a lot of trauma to your pelvic floor, that womb can be tilted. And if that cervix is closed up at all, or tilted towards your pubic bone or your rectum, the sperm isn't
Yeah,
going to be able to make its way. And it's, your uterus
absolutely.
has to be in optimal position in order to carry a fetus. And so that all really helps kind of get everything into the right position and make just everything
Mhm.
optimal and work well. Like you said, like cervical
Right.
fluid starts flowing better, probably periods start
Yeah.
being a lot easier, all of that. So,
Yeah, because it's not just for my like preconception patients. I do use it for that purpose, pelvic pain disorders, pelvic floor. It works so well with pelvic floor PT. I love
mhm.
co-managing patients with pelvic floor PT as
Yeah.
well. So it works so great for all of those
Yeah.
cases too.
How far, we're kind of going back now to trying to conceive.
Yeah.
How
Yeah.
far in advance should couples begin preparing their bodies for conception?
Such a good question. I loved, so it takes 120 days for an egg to mature. I love to go back to that timeline. So that's 4 months. So if you are wanting to get your body ready, let's give you at least a 6 month head start so that you are like that egg has time to mature and actually start seeing the benefits of that. So having that mindset, I mean, if I had my way, I'd say even a year. I don't want to create this like rumination about it though, either too far in advance where it's like everything has to be controlled and perfect because that's not what parenting is. So we're just setting you up for failure if you think it's
Right.
all going to go according to plan. But I do think having that mindset of like, I want to start working on, like, okay, I've identified these areas of my life that I want to work on before I become a parent. And you know, you're going to be sleep deprived and nutrient depleted and probably more stressed. So how can we build that resiliency leading up to that so that you can go through that process better? And I think it's a great thing to do as a couple, whether it's starting a new workout routine together, going for walks at night, going to bed a little earlier, starting to make those little changes, maybe identifying some nutrient depletions that you could work on, getting that homocysteine level down that can create issues with midline things like tongue ties, lip ties, like that. So,
Yeah,
yep. And then men,
absolutely.
it's 72 days. Like you roll over
Yeah.
that term every 72 days. So it's a little faster rollover, but still,
Yep.
I think it's takes two to tango. So walk that journey together as much
Oh,
as you
yeah.
can.
It's really funny. And I say this a lot too, and we've said this before. Women have all these things and da 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 da, and like men stop smoking and drinking, and like their sperm is happy.
Yes.
So, like, it's literally like Just a couple of things. It doesn't take a lot. And then on top of that, there's more things you can add. But yeah, it sometimes it's not like if you're a guy out there listening, it doesn't take a lot, but it also is you do your due diligence, right?
Yeah. And like help your lady feel supported. And if that means
Yeah.
that you're throwing a few more veggies on your plate every day, like, happy wife.
Absolutely. Do you have any specific red flags that people should pay attention to before trying to conceive?
Yes. So I would say either very short or very long cycles. So both scenarios would tell me maybe there's a problem with ovulation. So like you said, we want to establish is ovulation even occurring? That's a very important part of conception. Is bleeding happening when it shouldn't be, especially any blood at any time that shouldn't be there is always a concern that you want to get checked out. So those are some of my top things. I do think the cervical mucus piece, because that's how sperm is able to travel and stay protected and stay alive in the very acidic vaginal environment that's there unless the cervical mucus is there. So do you make cervical mucus where you can identify your fertile window and understand when you want to plan for intercourse? So understanding your cycle, I think, is the biggest thing. And if you just have no idea, maybe, that works out great for people
Yeah.
sometimes where it's not overly planned or curated, and that's okay. But I think the red flags is if there's a lot of irregularity in the length of your entire cycle. I would want to understand, do you have a very short luteal phase, or are you just not ovulating? So you have a lot of estrogen dominance going on. And that's something we want to understand. That's probably my top one. And then of course, the bleeding aspect.
Yeah, that's typically like if I see it on a chart and I'm like, okay, I think you might need some more testing. That's when I'm like referring to, I'm like, okay, this is what she needs, like this is where we need to kind of dive into and see what that root cause is, going back to functional health and diving a little bit deeper to make sure that everything is going to be right. And, like
Yes.
low progesterone, if you have low progesterone, you might have a higher risk of miscarriage. And so all of these things kind of play a role. But once again, like you said, don't ruminate. These are things that we want to be aware of when trying to
Mhm.
conceive.
Absolutely.
I know a lot of people, when they think functional medicine, they think supplements.
Hmm.
So what is your guideline? Is it to supplement, to not supplement? I know you said people come in and they're just on like a crazy amount of supplements that maybe aren't even
Hmm.
helping. So what are your guidelines and how do you kind of go about that?
Yes, I love to do what I call a supplement edit for people when they first come in. So that's a lot of times that initial visit where we're unpacking a timeline. I'm getting in my head maybe what testing I'm going to want to order or what first things that I want. I always want somebody to be able to leave with something actionable, whether it all right, I want you to focus on this macro or this sleep or whatever it is. But a really easy one is I want you to stop all of your supplements or only keep a couple of these that, based on what you're telling me, I think could be helpful. Because I see a lot of overlap sometimes where
Mhm.
you're not necessarily aware of what's in everything you're taking. And there's a lot of overlap, and we can definitely have too much of a good thing. And that can be just like medication has to be processed by your liver. Your liver has to process supplements too. So I think that that's a really huge thing. I'm really big into quality. So where are you getting your supplements? Is your fish oil from Costco? I love Costco, but their rancid fish oil is not for me. So I just hopefully not sponsored by Costco.
I have no sponsors. Someone
Sponsor.
could please, if you're listening and
Yeah,
want to
come on,
sponsor me,
sponsor,
feel free.
sponsor.
But
Yeah, come on, let's get it going. I have lots of companies I'd love for you to be sponsored by. So I want to ensure like what you're taking. Like I have the brands that I use, I understand, I know the quality, I know the efficacy of what we're going for with it. So I that's like one of my first things when I'm evaluating what somebody's on. And being respectful, like if they, are maybe they're I don't know, they work with a specific company, and they want to stick with these products. Like I will do my best to understand what it is that you're taking and find something that I would recommend through that product line. Like I really try to do that, but I'm most comfortable with the things that I use. And my rule of thumb in my mind is I never want somebody to be on more than 5 products at a time because it just gets way too overwhelming and complicated. So if we're working on maybe detox and gut microbiome and insulin resistance. And like you're working on all of these things at once. I also think your body has a hard time figuring out what you're trying to prioritize.
Yeah.
So I try to make that very obvious through the supplements I recommend.
Yeah. I also appreciate you saying, well, let's see. So, like, let's test and see where things are. Like, I remember, my vitamin D was critically low. My my copper was really high, and so those are some things that I think can be really helpful in just knowing where those minerals are before you just start
Mhm.
blindly throwing stuff at them, or you
Yeah.
start taking a beef liver supplement because your iron's low, but your copper is extremely high. And so you're like
Yes.
copper toxic, right? So,
Absolutely.
I think
Mhm.
that's where the functional testing can come in really handy because, yeah, you know why you're doing it, why you're taking it, and what we're helping. And then what I
Mhm.
also appreciate is we either retest or we see how you're feeling, and you're like, okay, so you're feeling good. You don't need to be on that supplement anymore. Like, let's be done with it for a little bit, right? And so
Mhm.
that also I think is very just it's like a conservative practice, whereas you see some of these people on there just selling all these different supplements and you're just like, okay, this is like way too much.
Yes, absolutely. And I think using testing to help you understand a picture. So I think a perfect example is cholesterol. People will see high cholesterol on their test, not understanding there's a difference between HDL, LDL, VLDL, and want to throw like in the natural health space, it'd be like niacin or something, something to like modulate how much cholesterol is there. And in my mind, it's like, no, wait, that is telling us something. Maybe your LDL is elevated, but your triglycerides and VLDL look great. So this doesn't seem metabolic. It's your LDL actually also takes nutrients out to the cell. It's being transported out of the liver to the cell for healing and repair. And this is, I think, more of a sign your body is trying to do that. So if we try to artificially lower it through supplements, A, I don't think that does you any favors when it comes to healing and repair. But B, it's like kind of faking the like you're just taking something to change that one level. So,
Exactly. Also understanding that synergistic of our body, like if it's doing something, there's probably a reason, right? So that can be really helpful to have that outside functional health perspective looking in and being like, okay, this is what I'm noticing. Here's your long history of XYZ, and why don't we, work on these things on top of
mhm.
maybe adding one or two things in.
Yep,
So, yeah.
absolutely.
I love it. If someone feels overwhelmed and doesn't know where to start, what are the first few things you typically will focus on? I know we kind of talked about it earlier, but if they're, just coming to you and they're like completely hopeless or just have like no idea where to begin, what are you going to offer them?
I think the first thing is because everybody has to eat, is just looking at your nutrition pattern. And maybe it is like that example that you were talking about, where it's the mindless eating or just the kind of like trying to eat while you're doing other things. So adjusting for that, because eating is like the first way we self-soothe as a baby. So I really latch on to that is a way that we can comfort ourselves, give ourselves a little dopamine hit. And that doesn't mean doing an extreme diet. It just means starting to understand what is the composition of food. A lot of people that I start working with maybe don't know what a protein source is. So it's let's talk about what protein versus carbohydrate and fat is so that you know how to build these meals and to start working on that education and awareness with the understanding this is a process and you don't need to know it all now, but being able to start identifying it, like is peanut butter high protein or high fat? Like that one always gets people. And
Yeah.
it's like, yes, it does have protein, but it's a lot like look at the label. There's a
Yeah.
lot of fat in there.
Yeah.
So yes, I think that can go such a long way because that's something you can give somebody fish or teach them how to fish,
Yeah.
like I that's going to be a skill that they're going to be able to use forever and continue to get better at. So I think nutrition needs to be a foundation and to start that conversation early so that you can transition off of a supplement and be like, let's go to, so I want you to stop that DIM supplement. Let's try to get a cup of cruciferous vegetables every single day in your
Yeah.
diet.
Yeah. I love
So,
that. And it's so much easier to do. I feel like once you learn those little switches, when I think of, vitamin C, okay, well, what has vitamin C in it that I can get versus just taking a supplement, like looking at those food
Yes,
sources.
absolutely.
Are there any common wellness trends that you feel are doing more harm than good? There's a lot. I
Ooh,
know I
there
can
are
think
a
of a lot, but I want to
lot.
hear your take on it.
I know. I think a really big one that gets people into trouble, is like fast weight loss stuff. And this will we could go into such a long conversation about peptides and all that kind of stuff, but I do think like our fat cells are a place that our body will store toxins and things that to keep us safe. And when you have really fast weight loss and you mobilize all of that very quickly, I think that that can get us into a little bit of trouble. So I think anything that is fast weight loss is worrisome. I mean, even just from bone density and muscle and all that kind of stuff. So being really careful and mindful of that, but also realizing if you're trying to do something where you're like doing an intense or harsh detox, but your gut isn't working well and you're not pooping every day, where does that go?
Mm,
Like, how are you going to
yeah.
get rid of it? So you're mobilizing it and you can't get rid of it. So I think when people are trying to biohack their own health without seeing the big picture, it has a good intention, but you don't see all of the pieces and how you may not get, not that something bad's going to happen every time, but you just aren't maybe going to achieve the goal you're looking for or
Yeah.
the outcome. So,
Absolutely. Yeah, I couldn't agree with you more. And I think from my perspective too, people who come to me with hormonal issues who are on GLP-1s or whatever, who have lost that fast weight, it's our estrogen is made in our adrenals, our ovaries, and our fat cells. It's stored in our fat cells.
mhm.
So, like you said, if we're losing that fat, our adrenals are exhausted because we're burnt out and our ovaries
Yeah.
are aging, we have no estrogen. And
Yeah.
so it's really important to kind of step back and look at that whole picture and work with a provider who understands these things and rather than just jumping on a TikTok trend, or a
hmm
quick fix like we talked about.
hmm
Yeah.
Yep.
Okay, we're gonna be done here shortly, but I want to do fun rapid fire questions. So this is a new one, but I thought it would be just fun to be like yes, no, or what is the first thing that pops into your head when I ask you this? So the
Okay.
first the first one is most underrated health habit,
Walking,
most overrated wellness trend,
detoxing,
one lab marker you wish more people understood.
fasting insulin.
Coffee, yes or no?
Yes.
I'm a no on this one, but I get it. I get
Definitely
it.
moderation,
It's
but
yes, moderation. Yes, definitely. If someone could only focus on one thing for their health this month, what would it be?
sleep,
The biggest thing women are missing when it comes to hormones.
blood sugar.
I would agree. Biggest thing men are missing when it comes to metabolic health.
I'm going to say blood sugar too.
Yeah, I feel like blood sugar is just an overall thing that everyone needs to know about. I feel like our
hmm
society is very insulin resistant as it is.
But I
Yeah.
think that for men, I know this is rapid fire, but I think for
Oh, you're good.
men, they're like when you have good testosterone, it can kind of hide that, and make it not as obvious unless you're like looking at some of those markers.
Yeah.
So,
Absolutely. I love that. Okay, I think that is all. Is there anything that you want to add to this conversation or that we maybe didn't talk about that you feel called to talk about?
I love that this is such a conversation. It's a conversation I get to have with my patients every single day and just helping to educate women about their bodies. I so appreciate the curiosity and the trust of when somebody does hire me or you or someone to work with to coach them through that journey. That is just such a beautiful gift. And I really honor that so deeply. And it means so much to me. So that is just my biggest thing that I am so proud of our generation of women. I think we
Yes,
are amazing. And my just hope is that for these future generations, we can keep building on that progress for us as women and keep asking for help and, teaching the next generations what we've learned.
absolutely. Today's conversation was such a powerful reminder that our symptoms are not random and healing is rarely about finding one quick fix. True healing takes time, curiosity, consistency, and a willingness to look deeper at the whole picture, not just isolated symptoms. I'm incredibly grateful to providers like Dr. Theresa Osmer, who has been helping shift the conversation around health by truly listening to patients, asking better questions, and focusing on long term healing instead of temporary band aids. A huge thank you to Dr. Osmer for coming on to the Hippie Martha Hormone Hour today and sharing your knowledge, wisdom, and experience with us all. I know this conversation is going to help so many people feel more empowered and hopeful in their own health journeys. I will definitely put on here how we can connect with you, but if you would like to share how people can connect with you, that would be great.
Absolutely. So you can find me in person or virtually. My website is flowchiro.com, which is all of our services, chiropractic, Mercier therapy, functional medicine services. And then I have my own Instagram, Dr. Theresa Osmer. So that's where I like to post content for that's just for me and for the people that I'm really trying to serve and speak to.
Yeah, and you give lots of good information on food and nutrition on there too, which I take away bunches of information from that. So thank you for
Fantastic.
sharing that.
Fantastic.
If today's episode resonated with you, be sure to share it with someone who may need to hear it. And don't forget to subscribe to the Hippie Martha Hormone Hour for more conversations around hormones, fertility, nourishment, and holistic healing. Thanks for hanging out with us today. I'll catch you in the next episode.